If you had to give up one of your five senses, which would you choose? For most of us, the answer is easy: smell. We tend to treat our nose as a luxury feature, nice for enjoying a good cup of coffee, but totally expendable if it ever breaks down. But losing that sense is far more common than we realize, especially in later life. By the time people reach 80 years old, nearly 2/3 of them are living with a significant physical impairment in their ability to smell. This chart shows the gap between our perceived sense of smell and the clinical reality. Only 9.5% report having a problem, but when objectively tested by doctors, the true failure rate jumps to nearly 25%. We simply cannot trust our own perception here. Because the sensory decline happens so gradually, age-related smell loss operates as a massive, silent blind spot in our personal health monitoring, and that blind spot is hiding some serious neurological stakes. Long before any memory slips or physical tremors appear, a failing sense of smell often acts as one of the very first warning signs for Parkinson's and Alzheimer's diseases. Looking at this survival curve, you can see exactly how high those stakes get. The top baseline tracks people with normal olfactory function. The bottom line tracks those with clinical olfactory impairment, who face a stark 52% higher risk of overall all-cause mortality. So how exactly is your nose tied to your lifespan? To understand the connection, we need to look at how the physical structures break down, how doctors actually measure the damage, and the daily steps you can take to rebuild the neural pathways. Far from being a background feature of human anatomy, the nose is a highly accurate predictive barometer for your overall longevity and brain health. To understand why things break down, we first have to separate what happens on the tongue from what happens in the brain. Your tongue is only responsible for 5 basic tastes: sweet, salty, sour, bitter, and umami. Everything else you experience during a meal is actually flavor. Complex flavor relies on retronasal olfaction. As you chew, air flows from the back of your throat, carrying odor molecules up into the nasal cavity. This is the opposite of orthonasal olfaction, or sniffing, pulling odors straight in through the front nostrils. So when older adults complain that their favorite foods have suddenly become totally bland, their taste buds are usually working fine. They are actually experiencing a structural failure deep within this hidden olfactory system. The delicate sensory nerve cells inside your nose face 3 primary physical threats over a lifetime: chronic inflammatory sinus blockages, severe viral infections that wipe out the tissue, and blunt head trauma that severs the nerve fibers entirely. Because this damage is buried deep inside the skull, and our own self-reporting is so flawed, doctors don't rely on us to tell them what's wrong. They pull hard data directly from our senses using objective psychophysical tests like standardized smelling sticks. This generates a TDI score. T is threshold, measuring the faintest scent concentration you can detect. D is discrimination, testing if your brain can tell 2 different odors apart. Finally, I is identification, forcing you to accurately name a specific smell from multiple options. By combining these 3 metrics, the TDI score takes a vague, subjective complaint, like "my dinner tastes boring," and turns it into an actionable, measurable medical baseline. Now for the biological good news. Unlike the vast majority of nerves in the human body, the sensory neurons tucked inside your nasal cavity possess a unique built-in capacity to physically regenerate themselves. Doctors harness this regenerative power through olfactory training. You can think of it as a form of non-invasive physical therapy, specifically designed to relink your brain to your nasal pathways. The clinical protocol is low cost and remarkably simple. You deliberately expose yourself to 4 distinct botanical odors, typically rose, eucalyptus, lemon, and clove, spending a few concentrated minutes smelling each one every single day for a minimum of 12 weeks. For patients dealing with smell loss caused by viral infections or head trauma, this consistent daily exposure leads to documented significant improvements in their overall TDI scores. Losing your sense of smell does not have to be a permanent, inevitable part of aging. It is a highly treatable physical condition, provided you actively put in the work to rehabilitate it. Which leaves us with a few concrete rules to implement starting tomorrow. First, don't guess, test. If your meals are getting bland or your nose feels weaker, don't write it off. Ask a doctor for an objective clinical TDI test. Second, pay attention at the dinner table. Consciously note whether you are losing basic tongue sensations like saltiness and sweetness, or if you are actually losing the complex retronasal flavors that travel through the back of your throat. Third, you don't need a prescription to start protecting those pathways. You can proactively begin a simple olfactory training routine at home using basic essential oils. Maintaining your sense of smell provides a constant, real-time read on your neurological performance. By treating it as an active vital sign, you turn a background sense into a primary defense for your long-term brain health.